Hi, everyone. This is Darwin Ruiz, host of the Medical Exercise Specialist Vlogcast, where we talk about the principles, strategies, and standards and guidelines for medical exercise professionals. Dr. Mike is here once again to join us. And
Hello.
today we're going to be talking about really how to think like a medical exercise professional. So we're going to talk about really the things you want to keep in mind as you're getting started with a new client, as you're taking them through the process. So Dr. Mike, let's talk about what exactly do we need to start thinking about, or how do we need to start thinking when we're working in the area of medical exercise?
Yeah. And you know what, Darwin? Over the last 28 years, as we've trained medical exercise specialists, we do realize there is a significant transition from personal training as a fitness professional to medical exercise training. There's no doubt about that. I think you did an earlier podcast with Israel where you guys talked about some of the obstacles. And we realized one of the obstacles is just simply the thought process. Now, let me say this. We're not saying you're wrong if you don't think this way, but we're saying that thinking this way makes it significantly easier to make the transition, as well as dealing with the obstacles that the two of you gentlemen talked about. So we've identified, I think there are 8 that we've identified that we feel are significant mind shifts that fitness professionals need to make to really build, sustain, and manage medical exercise training clients for long periods of time and do it very well. Yeah.
Okay. So what would be then one of the things we would need to keep in mind then as we're getting started
Wow.
with a,
There,
with a
there are
new
8 of them.
with a
So
new client, for example? So
yeah, there are 8 of them. So we're going to be here for a little bit on this one.
okay.
The first one is, as a medical exercise professional, it's not a focus on exercise. It's a focus and an understanding on the related anatomy and pathology of the client's condition. Because to some degree, that dictates the exercise. If you don't have an understanding of the client with a meniscal tear or a hip replacement, or even a client with hypertension or diabetes, if you don't have an understanding of the related anatomy and the pathology, which means what's gone wrong with the anatomy and pathology, you're kind of, just whistling in the wind. You just kind of throwing out exercises, and some of these exercises could easily be contraindicated and cause the client more problems than they're worth. So I think the first one is you have to have an orientation toward clinical, not basic anatomy or basic gross anatomy, where you know muscles and bones, but the clinical aspect of it, along with understanding the related pathology of various medical conditions. You have to.
So for example, let's say your client comes to you and they have a rotator cuff tear. You're saying we need to
Mhm.
understand not just what the rotator cuff muscles are, but what level or what degree the tear is, right?
Mhm.
Kind of
Mhm.
the functional implications as well, and
Mhm.
then what contraindications, what exercise they shouldn't do, what they should
Right.
do, how
Right.
to sequence them, how to program that. So all of that.
Yeah. Yeah, the whole thing. And as medical professionals, being a physical therapist, when I refer my client, I'm expecting you to know that because one, if you've come to me for a referral, I didn't force the referral on you. You came to me. So I'm assuming if you're going to play in my sandbox, right, my playground, you're playing the same games I play and or using the same mindset I play. That's what every physician, therapist, and chiropractor is thinking when you enter into a relationship where we're referring clients to you. That's what our thought process is. Yep.
Okay. So once we have a grasp then of the client's condition or their diagnosis,
Mhm.
what then else do we need to be thinking about?
I think in this day and age, we have to start thinking about wellness, and wellness starts with in the fitness professional making that transition to medical exercise training. That's one component that we say you need to bring along with you is the wellness, understanding of wellness and how exercise impacts on that, which means you now also have to bring along the idea of checking the client's vital signs, if nothing else, heart rate and blood pressure. Now, we've just gone through this COVID pandemic and we're still in it. So let me make sure it's not over, it's still around. But vital signs give us an idea of the client's homeostasis, where they are. And I think for a lot of clients that are coming into your door, and I would imagine most of your clients probably, Darwin, in their 40s or older,
Hmm.
that's prime time for hypertension. That's prime time for elevated heart rates and high temperatures, high respiratory rates. I think one of the first things we need to remember as medical exercise professionals is you're the first line and the last line of defense in this whole healthcare crisis we have, which is based on chronic medical conditions being out of control. You'd be surprised checking your client's blood pressure. You may find a client that has a blood pressure that's astronomical and they didn't know it. And I'll give you an example. Darwin, I hope I look normal and healthy for the most part sitting here right now, but I'm a hypertensive. I've been hypertensive since I was an Army officer back in the 1980s. My blood pressure runs somewhere around 130. 136, 138 over 94, which is considered abnormal. I'm on blood pressure medication, even though I exercise on a regular basis. It's just one of those things. So should you check my blood pressure and my heart rate at a minimum before I start the exercise program? Yeah. And if it's extraordinarily high, should I exercise that day? No. So to some degree, you may have to protect me from myself. And if I get upset about it and say, hey, I want to exercise anyway, let me sign a waiver. And if something happens to me during that session, it's not on you, it's on me now.
Right.
So I think that's prevalent. And it's the hidden killer. We have a lot of people out there that are hypertensive and diabetic, which means we need to check heart rates. We need to check blood pressure. And that's easily done with an automatic blood pressure cuff. I'm not a fan of them. And with a pulse oximeter, everybody got one during COVID. So use them. I think that's important.
And so some of these vital signs you do every time you see the client, or is that going to depend?
Yeah, I think for your new client, you need to check vitals, at least heart rate and blood pressure, the first 2 or 3 sessions. Okay. And if those values are normal during those first 2 or 3 sessions, you're good. If the client tells you they're hypertensive, then you need to check their blood pressure every time they walk in the door. And normally a blood pressure value gives you a heart rate value too.
Right.
Yes.
Okay. Mm-hmm. So we've taken the client's vital signs in. What do we need to think about next?
Yeah. For the medically based client, they've told you I have a medical condition. That's why I'm coming to see you. Either my doctor told me to come see you, my therapist, my wife, my husband, someone told me to come see you because it's a medical condition. You probably need to think about doing some type of medical history interview beyond, did your mom or dad have, hypertension, what diseases run in your family. You probably need to get a better idea of when this started for you, when this condition was diagnosed, what has been done for it thus far? What has the physician recommended, or the therapist or the chiropractor? What makes it better? What makes it worse? So you have a better understanding of the client's tolerance level for exercise. So doing some aspect of a medical history interview, so you aren't just kind of, well, the client has this condition, but I don't know anything more about it. That's the ostrich. You're sticking your head in the sand. You probably need to get a little bit more information on that.
Now, this is distinct from a PAR-Q, right? Which is something I know in personal training and in fitness, the PAR-Q is sort of what most people think of. So this is something different.
Something different. Yes, sir. The PAR-Q, literally what most of the time we do with the PAR-Q, you go down a list of questions or the PAR-Q form and you just check things off. The PAR-Q actually isn't a bad thing. So I'm not saying that, but we need to do more than just simply have the client check off these boxes and we never look at it again. That's the biggest thing. We never look at it again. And if we do go back and look at that PAR-Q and we see some concerns there, we need to ask more questions. I think one of the things we commonly do now in fitness, when clients join the gym, they do go through that PAR-Q form and you stick it in the client's file and you never look at it. Right. But the client told you he had a lobotomy done last Friday, and you wonder why he's acting so weird in the gym. And then you go back and look at the form 2 years later, and the guy had a lobotomy. You're like, well, I understand now. Or the guy comes to you and says, I injured my knee, and you never take the time to find out, well, what was the injury? What was done? Who diagnosed it? What was the diagnosis? You just kind of, well, let's get started with some exercise.
Right.
No, it won't work.
And this is also then the time too where you would need to get any medical records, right, if necessary.
Exactly.
I guess once you do once you do the medical history, you're going to see, okay, I need to get medical clearance. I need to get certain documentation, right?
Right. Okay. And you see, just simply this step now elevates you to a much higher level. And I realize it's harder for people to do. Hey, if you're going to get $100 from that personal training client and you don't have to ask questions, it's great. But now you're dealing with the medically based client. There's a little bit more liability that goes along with that. So you have to make sure you've done everything that's reasonable and prudent and professional.
Okay. So the clients come to us. We need to understand the anatomy, the pathology of their diagnosis. We need to take their vital signs. We need to take a medical history. What comes next after the medical history?
with that medical history, as you're interviewing the client, you're looking for red flags, numbness and tingling, radiating pain, chest pain, or shortness of breath, open wounds, loss of range of motion, loss of strength, diminished cognitive capacity, abnormal vital signs, and one that a lot of people don't pay attention to, swelling, an open wound, which I think I may have mentioned earlier, but also we find chest pain and shortness of breath. That's a huge one, and one a lot of people don't pay attention to: night pain. Uh, Years ago at Medical Fitness Pros, we had a client come in the door working with one of our trainers, and the guy just looked disheveled. I mean, just it was 9 o'clock, 10 o'clock in the morning, just looked just like he had just rolled out of bed. You're like, whoa, what's going on here? And the guy says he hadn't been able to sleep in 2 or 3 days.
Wow.
Well, after you can't sleep for 2 or 3 days, you become disoriented. You have some major problems. Come to find out, the guy was having abdominal pain that was excruciating at night. During the course of the day, the abdominal pain would diminish. So night pain, pain in the pelvis or the torso that is unrelenting at night, goes away to some degree during the day or diminishes during the day. That's a sign that we probably have some type of internal organ issue going on. And luckily, we found with this person, they had an appendicitis that was caused by a infection of the intestines. If this had gone on 2 or 3 days more, this person would probably end up needing a colon resection done. And just by chance, our medical exercise specialist picked it up and said, "Hey, you need to see the doctor." I went to the doctor and it was something pretty serious. So yeah, anytime we look for red flags, that makes a huge difference. And we'll include a diagram here of the red flags so your audience can take a look at it.
And that's part of the initial screening process, right?
Yes.
Identifying the red flags. And I think it's important to distinguish here that the screening process is not the same as the assessment, correct?
No, no. The screening is just simply that. We're screening the client to make sure they're appropriate for exercise because they told us they have a medical condition. Just because they came over for exercise or Dr. Smith sent them, it doesn't mean necessarily they're appropriate for exercise.
Okay. Okay. So then the next step after that, then what's the kind of approach then that we need to take once we've got all this information? How do we proceed with this client?
Right. Once we got the information, now we want to try to use some type of protocol-based approach. And I know for most trainers, you're freelancers or you're, you create your programs independently. But when we look at a medical condition, we need to make sure we cross all the T's, dot all the I's, and we make sure we're managing all aspects of the medical condition. So sometimes looking at, referencing, maybe not following verbatim a protocol does become important. And Darwin, if I can give an example that isn't in the medical exercise training world, but is in the medical realm, cancer. We're seeing a lot of immunotherapy treatments now. Immunotherapy is primarily protocol driven. It's a protocol or a number of protocols that are out there based on the condition. And the protocols say we do this, 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 and this. Now, I've got a very close friend who's in immunotherapy protocol now. He lives in one of the northern states. And his doctor would not deviate from the protocol. So I'm not saying blindly follow the protocol. He came to a facility here in Houston and saw someone not too long ago, a physician here, and they made some modifications to the treatment protocol. He's doing much, much better. So please, I'm not saying adhere to the protocol at all costs, but protocols allow things not to fall through the cracks as long as you understand how to apply it and you make the necessary adjustments. There's an old saying we have here at the Medical Exercise Training Institute: manage the condition, but train the client. Managing the condition says we're going to do the management of this condition, total hip replacement or ACL tear, this way, but we're going to train the client because maybe we have a client that's hypertensive. Maybe we have a client that can't come twice a week. So we're going to make some modifications so we can accommodate that client and produce the best outcome we can.
Yeah. Okay. So then, and again, as a protocol, it's essentially, I guess, can we look at it like a sort of a checklist, right?
Yeah.
Even though, as you said, we may not need to adhere to it strictly, but it just gives us something to follow and say, okay, have I done this? Have I done this?
Right.
And that just, as you said, makes it a lot easier.
Yeah. And nothing falls through the cracks that way. Yes.
Okay. So in terms of, again, we're talking about thinking like a medical exercise professional. So what then do we also need to think about as we move forward with this client?
Ooh, documentation. That's the one nobody wants to do.
Mm,
Documenting stuff. With the medically based client, you got to write down what you did. You have to.
mhm.
You can't just kind of, well, we did this on Tuesday and now on Thursday we're going to do this. With that medically based client, we have to have a record just to say what's working, what's not working. And as medical exercise training becomes more and more accepted and understood and embraced by the medical community, we're going to need to document this stuff. And I guarantee you, Darwin, at some point, insurance carriers are going to start paying for some aspects of this. Insurance carriers don't send out a check just because you said you did it. Insurance carriers send you a check because prove to me what you did. That's what we have to document.
And so documentation includes, I think coming from the personal training background,
Mhm.
we typically think of, well, the workout logs, right? So what we're doing in a session, but there's more to it
Yeah.
than that with medical exercise, right? There's the
Yeah.
assessment, there's
Mhm.
the documentation we might use to communicate with a medical professional,
Mhm. Yeah.
like,
It's the session log itself, the progress report we may send to the medical professional. So it's not just simply the training log, the number of sets and reps, on the typical gym form. It's now giving us a record of what was done during that session, as well as what we're seeing as far as progression with that client. So it's a little bit more than just simply we wrote it down in the gym scribble, and I use that term and not derogatorily, but we wrote it down. Now we actually have to kind of give an idea of the reasoning behind it, some level of representation and interpretation of it, so that now we have a record that makes sense. And the other thing, too, is at some point, you may have to refer the client out to another medical exercise professional or to a medical professional. That's what we have to document. Yes.
and I know that in the medical field, there are kind of rules to follow with regards to documentation, not just
Yeah.
how you're doing it, but also where you're keeping your documents. So can you talk a little bit about that real quick?
Yeah, good question. Back actually prior to the passage of the Affordable Care Act, or what we know as Obamacare, there were guidelines out then on through HIPAA, which were saying, here's how we're going to protect client information. Most people don't realize HIPAA initially was only for Medicare here in the United States, and it still applies to Medicare. But what's happened is third-party insurance carriers, and Medicare is the largest health insurance entity, for lack of a better phrase, here in the United States. All third party carriers, Blue Cross and Blue Shield, Aetna, Cigna, Liberty Mutual, have basically said if Medicare does it, we're going to do it too. So it's become the law of the land. Originally, it was just for Medicare, but it's become the law of the land across the board, which says you have to protect the client's confidential data. You have to keep it private. So you can't leave the client's chart out with their name and their phone number and everything out on your desk in your office when you're training the client and you're in another room. Anyone can come in and look at that information. The guideline says you have to keep these medical records or these contact or these client records under lock and key when you're not using them. So that becomes very, very important that we do that and adhere to that.
Okay. So documentation, and what would be the next thing to think about?
Ooh, if you're going to document it, you got to communicate it.
Right.
So in many instances, personal trainers never talk to physicians or therapists or chiropractors,
Mhm.
whatever reason. At some point, if you're a medical exercise professional, you got to talk to the doctor, therapist, or chiropractor.
Mhm.
If nothing else, and when I say talk, let's use a better term, communicate. Send them a progress report. Think about it. How many clients do you have that could accurately tell the physician the exercise program that you are utilizing with the client to improve or lower their blood pressure values? Well, we do a little bit of this and we get on this thing and do that. Clients, they have no clue of what's going
Right.
on.
Right.
So you've got to provide an accurate representation of what you're doing. So the medical professional now has a better understanding of you, but a better representation of you.
Mhm.
So that communication becomes vitally, vitally important. Has to be important, vitally important.
And that's not just through documentation. It's also, I know you've talked about when we are speaking with let's say a
Yeah,
doctor on the phone,
yeah.
to make sure that we're using the correct terminology. So
Mhm.
rather than saying, for example, oh, my client has a shoulder pain, right,
Yeah.
or a shoulder issue, to
Uh-huh.
my client has impingement syndrome, or
Yeah. Yeah, or a
rotator
rotator
cuff
cuff
tear.
tear. Yeah, because in the
Yeah,
medical community, we think in terms of diagnoses,
right.
specific diagnoses, because that's how we manage them. And let me say one other thing. We also think of clients in the terms of not necessarily the client, but the client with this
Mm.
condition. You know, Mr. Ruiz, oh, the guy with the rotator cuff tear, because you're not coming to us unless you have a medical issue. You're just not.
Right. All right, Dr. Mike. So what is the is there, you said there's one more thing that we need to be thinking about in terms of thinking as a medical exercise professional. What would that be?
And the last one is medical exercise training is finite. And what I mean by that is, you know, you'll get a personal training client, you can keep the client for years. And there's nothing wrong with that. With the medical exercise training client, we establish short-term and long-term goals, and we get the client to achieve these goals. And once they've met the goals, then we don't have to provide medical exercise training anymore. We can now move them on to just simply personal training.
Mm.
Um, Medical exercise training was never designed to be infinite. So it's almost like we're going to ratchet down the intensity, and the intensity doesn't necessarily have to be exercise intensity. It could be just simply your involvement intensity. Obviously, when you went through the medical exercise specialist workshop, you had to put in a lot of time and effort. It took your skill set and your knowledge to a higher level. Once you've gotten that client to a certain point where you've achieved the goals, can you now still provide exercise, but does it require that you still keep thinking as the client, utilizing your medical exercise training expertise? Or
Right.
can it now be just simply personal training expertise? Because if they're medically stable, you've got them to certain goals, can we now ratchet it down a little bit? And think about it this way. Probably the most expensive entity in healthcare is a night in, or visiting the ER is probably the most expensive entity. And then a night in the hospital is next. And then you find, as we go down the list, going to a nursing home and then eventually going home, period. You know, we have home care coming in. I think one of the things we have to look at as we start to interact more with the medical community and even with insurance carriers, we have to look at the idea of cost controls on our end. And okay, we've got medical exercise training one-on-one services, which is probably, you're going to price those higher than personal training. Does the client need that level the rest of their life, or can we get them to a plateau and then step them down where you're still exercising and providing services, but now is just simply personal training or functional maintenance services? And that's why we
Right.
say medical exercise training is finite. At some point, we reach goals. Exercise is infinite. And with exercise being infinite, can we have different levels of exercise? Yes, I think it's something we need to start thinking about down the road. Yeah.
So medical exercise is finite.
Mhm.
Exercise it
Is infinite.
isn't.
You
Gotcha.
got it. Yeah.
Okay. And I think too, if you are, let's say, a medical exercise professional and you have your own facility, that might look like maybe as you're working with a medical exercise client, you're allowing other clients to come in once they've been kind of stepped down or graduated to
Mhm.
just personal training, or where they can maybe exercise and you're there, but you're not necessarily
Working with
working with them. So there's a lot of different ways I imagine that that can be done.
exactly. Yep,
Okay.
exactly.
Well,
Mhm.
Dr. Mike, I think those are really great things to think about as a medical exercise professional. And just to recap, we want to understand the anatomy and pathology. We want
Mhm.
to take the client's vital signs to make sure that we're establishing homeostasis.
Mhm.
We want to take a medical history. We
Mhm.
want to do a screening to identify red flags. We want to use a protocol based approach, not just to make things easier, but to make sure things don't fall through the cracks. We
Mhm.
want to make sure we document what we are doing. We also want to communicate with medical professionals using documentation, but also on the phone, maybe even in person. And then finally, we want to keep in mind that medical exercise is finite, whereas just regular exercise is infinite. So we
You
want to
got it.
keep in mind the goals that we're trying to achieve. And once we achieve them, where does the client or what does the client do next? Um,
Exactly.
cool. Well, thank you, Dr. Mike. I think
It's
that
my
really
pleasure.
is very helpful. And thank you, everyone, for tuning in. And if you want to learn more about medical exercise, how to become a medical exercise specialist, visit www.medexpronetwork.com. You can join the community. You can connect with other medical exercise professionals. You can learn how to grow your practice and just develop your skills. Again, that's www.medxpronetwork.com. Thank you, Dr. Mike, and we'll look forward to seeing everyone else in the next video. Thanks.
Thank you, sir. Take care, all you guys.